my top tips for lower back pain. We are in April and we're talking all about lower back pain. Now, if you missed our previous videos, we talked a little bit about, what normal is, what normal structure is, neurological function, what normal function is generally, how we can assess that function to see if there's a shift away from normal. And then today I want to give you some of my top tips of things that you could do to really help, first of all, keep it healthy if it is healthy, and number two, if it isn't healthy, a, approach that we could take to slowly and deliberately restore health back into that area. Now, when it comes to restoring health or maintaining health in that lower back, I think we need to start with movement. And if we look at movement as like a pyramid of types of movement, moving slow is really the base of that pyramid. So that's going for a walk. There's something unique that our spine, particularly our lower spine, gets from walking, which we don't get from running or jumping or swimming or cycling. So walking offers us something unique. Now, I recommend a minimum of 30 minutes a day. If you do more, that's great, but we want to get at least a minimum of 30 minutes a day. Now, quite often, especially if that area is not expressing optimal health, walking can sometimes create some problems. So in terms of pain and avoiding pain completely doesn't necessarily help that joint healing. Sometimes moving a joint through a good range of motion, if the pain is reasonable, can actually help encourage the healing in that area. So, just because we feel pain doing a movement doesn't necessarily mean we completely have to stop doing that movement. This is, of course, within reason. We do want to approach things in a logical way. But let's say, for example, we can't go for a 30-minute walk. How much can you do? Can you do 20 minutes? Can you do 15 minutes? Can you do 5 minutes? Just start doing something, doing it consistently. And if you can't do that long, do it frequently through the day. And then over time, you'll see that your capacity and strength kind of grows. Now, in terms of movement, like I said, that's the base of the pyramid of movement that most of us aren't actually meeting. So that's a good one to really focus on. Now, that is what I call active movement. Now, there's a lot of benefit to passive movement. Now, this is what a chiropractor does when you come into the practice. There might be some parts of your spine that aren't moving well. So it's good to get someone to get in there and get that part moving well, so that then when you go for your walk, all the joints are getting the benefit from that movement. Now, in terms of movement, we can take a little bit further and talk about some specific movements as good for that lower back. Now, range of motion is really one of the key ones here. So if we look at the hips, the pelvis, and that lower back, most of us these days, we only bend our hips to about 90 degrees. Now, your hip could probably bend 120 to 130 degrees. So if we only ever use 90 degrees, at some point you lose the ability to access that last little bit. And this is a problem because, of course, it's that user or loser principle. So when our hips in particular don't move through that full range of motion, they reduce in their mobility, they get stiffer, they get less malleable and able to adapt to stresses and forces that you might be exposed to. But even when we look into that lower lumbar spine, so you've got 5 vertebrae in your lower lumbar spine, and those lower discs, L4, L5, they don't really move very well till you get to below 90 degrees. Now, in the Western world, like I said, most of us don't move below 90 degrees. So, surprise, surprise, that's where we see the most amount of degeneration or osteoarthritis in the lumbar spine, is in those lower 2 discs. Where if you go to other countries where they squat down to the ground more routinely, you don't see nearly the amount of lumbar disease that we see in the Western world. So what do they do differently? First of all, the squat is a resting position. So if you're waiting for a bus, you're not sitting on the bus bench, you're sitting in a squat on the sidewalk, getting to below that 90 degrees. When we're having dinner, we've got low dinner tables that sit on the ground. And simply, if you just now sit down onto the ground, you'll see that your hip, your shoulders, your lower back, everything's moving through a fuller range of motion. So if we're just sitting on the floor more often, then that's going to encourage that big range of motion through there, particularly for that lower lumbar spine. And in a lot of those countries, when you go to the bathroom, that's a hole in the ground or a toilet that's quite low to the ground. And again, that brings those knees higher than 90 degrees. This is good for like the elimination process itself, less force needed, but it get those hips, the pelvis, and that lower lumbar spine for a fuller range of motion. So that's 2 action steps for this week. It's just essentially move more and move more of yourself. Move your body for a bigger range of motion as often as what you can. Until next time, have a great day.